Our continuing coverage of Green Build 2015 live from Washington, D.C. with Healthy Indoors Magazine. With me this morning is Larry Zarker, the CEO of the Building Performance Institute. Hey, Larry.
Hi, Bob.
Good to see you.
Thanks for having me in.
So, really happy that you could stop by. Our focus, obviously, for most of our readers and viewers is indoor environmental, dealing with indoor air quality issues. But of course, that encompasses the entire building envelope and really the whole structure and how buildings perform, which I think goes right in, plays right into the Building Performance Institute's programs and mindset. So, what I would like to know is, first of all, a little bit, give a quick synopsis to people that aren't familiar with you, what the Building Performance Institute is.
Okay, we've been around, BPI has been around for about 22 years. We set standards. We're an ANSI standards development organization on how do you analyze the home and how do you upgrade the performance of the home. That's single family and multifamily. We then created a suite of certifications for professionals to go out and analyze the home, that's the building analyst, or upgrade the performance, that's mainly the envelope, the heating, and the AC heat pump systems. So optimizing whole house performance.
And it's predominantly, you're both in the residential, multifamily, but also in the commercial a little, or more so residential and multifamily?
A lot of our contractors do both. They are in light commercial. I wouldn't say they're in heavy commercial or industrial, but there is a crossover into commercial. We have a set of contractors who are our elite contracting companies called Gold Star Contractors, and what they commit to is following our standards on every job and using certified professionals to make sure that the work is done well.
And back in my previous life, I actually held all the certifications too, so I was involved in building performance a bit. The BPI standards and accreditation seem pretty rigorous. Actually having to do real practical demonstrations of your knowledge as part of the certification program. That's still the case, I'm assuming.
It is. The exam for each of the certifications is a 2-hour written test, 100 questions for knowledge. But beyond that, you have to go into the field, into a home with the diagnostic equipment in a real world situation and prove that you have the competency to actually analyze what's going on and diagnose where the problems are.
And that's huge, because it means that, in some other industries, at least even in the indoor environmental industry, some of the certifications are really only a written test. So it proves that somebody can pass a multiple choice exam. It doesn't really prove that in the field where the rubber meets the road, they actually have any practical knowledge performing.
My mechanic, I love him to death. He has the ASE certification for a mechanic, but it's a written test. He didn't have to take the engine apart and find out what was going wrong with it. So we feel very proud that the practicum is very useful because it helps you understand how to use the diagnostic equipment in the field.
Yeah, I think that goes to the core of it. Now, BPI has been around for quite a while, but it seems I'm hearing more about it on a national basis. I'm from New York State, and we're based there, and it's always been fairly well received and fairly heavily endorsed in our region.
Right.
But I'm seeing more of it around the country. Can you speak to that a little?
Yeah. So I came to BPI in 2006. I was with NHB Research Center with the home builders for 20 years before that. And we had 6 centers doing testing around the country at the time. And we grew that to over 170 test centers with community colleges and training centers around the country. So we went from a few regions where we were strong to every state now has certification. So every state, a consumer can find someone to not only have the audit done, but actually have the work done in their home.
That's great. And that certainly, I think, hopefully will improve the standards of some of the construction practices that are being done. And at the very least, the retrofit work, there seems to be a lot of performance retrofit taking place in the building stock in the country too.
Right. So we did cross over in the last year into the new home side with an infiltration and duct leakage certification. The IECC, the International Energy Conservation Code, starting in 2009, required an air infiltration test and a duct leakage test for code compliance. We'd long had those, but they were in different certification exams. So we put them together, and now individuals can have that certification and do code compliance verification for a builder on a new home.
Great, great. And that would involve a blower door and a duct blaster?
duct leakage equipment. It doesn't have to be the duct blaster itself.
Yeah, I guess it's brand name.
Yeah, it's a brand name.
Oops.
Our standards, our core, have always been about comfort, health, safety, durability, and energy efficiency. But when you look at health and safety, our standards, our certifications primarily have looked at gas leaks and carbon monoxide spillage. Very important things, but that's not the totality of what we're finding is going on at home. So we've been pushed, and we've been looking at what we should be doing on top of what the building analyst does or our energy auditor does in the field to assess the home. And what doctors are finding is that people are living and working in the built environment 95% of the time, whereas 100 years ago we were out in the fields doing work, right? And now we're in the home so much that the home environment is actually potentially dangerous for us. So I have a presentation that I give called Our Homes Suck, and that's why our kids have sinus problems. Well, the reason our homes suck is because of stack effect. Stack effect lifts air up, brings air in from places we cannot trust. That's like crawl spaces or basements. So across that band joist, which could have fiberglass, which effectively filters what's coming in from a wet, dark, rodent-infested, either living or dead kind of environment. And that stuff comes in 15 feet away as the air handling unit. It distributes this through the ductwork system. We all breathe it. And then it comes back through the return and finally hits the furnace filter. So we've been breathing all of that air. So I say to people, how many of you think that a house can get made too tight and it's going to cause problems with indoor air quality? 75% of the room raises their hands. And I said, you know what the problem is? That we have 134 million homes in America that are loose. 2/3 of them were built before modern energy codes. And we're breathing bad air from places we cannot trust. And then you add to that you have mold from water penetrations, or you have dust mites in mattresses, and there are other things going on that cause respiratory problems. And that's what we're trying to do, is we're trying to build a new micro-credential that will reside on top of building analyst or energy auditor, and we're calling it the Healthy Home Evaluator. So the Healthy Home Evaluator will use the experience with the diagnostic equipment of the building analyst going in and analyzing the house and looking for problems, but they're going to build on top of that to look for other health and safety related issues.
Yeah, and that's actually, I think, a paradigm shift for both industries, both the building envelope or the building performance side, as well as the indoor environmental. Years ago, as a consultant, I'd been an indoor environmental consultant for 30 years. I recognized, and many people I think around the country recognize how they interact. I mean, there's an interplay between your indoor air quality, certainly, and how the building is actually, the envelope of the building's performing and all those parameters. And I think, 20 years ago, even 15, 10 years ago, you didn't see those two disciplines crossing over as much as they are now. And now it's not uncommon to see an IAQ consultant with a blower door.
Right.
Doing pressurization
Right.
checks, which of course is critically important to understand pathways and pressure differentials, and vice versa. People that would be classically just on the energy side, home performance, now really do need to take that into account, because I think you do.
Yeah.
So.
And there's real money being spent here. Green and Healthy Homes Initiative out of Baltimore did a study in Baltimore of 100 homes, low-income homes, children with asthma. They found in complete weatherization of those homes that they had a 67% decline in emergency room visits by kids with asthma. Aetna came in and estimated that the emergency room visit is worth $800. And if they stayed over in the hospital, that cost is $8,800. And asthma is one of those conditions that has repeat flare-ups, and back to the emergency room, back to the hospital. So 67% reduction is something that Medicaid and ultimately managed care is going to see that we have an ability to bring those numbers down. So the challenge is that we need coalition building. We need to have all the different elements together. So we're working with the medical community. Children's Mercy Hospital out of Kansas City, for example, is a leader in this field. They've been for 10 years looking at protocols for how you do interventions in homes, over 1,000 home interventions, and they've discovered that the medicine wasn't necessarily leading to a cure, and they had to look beyond the medicine to protocols that would say, let's go into the homes and find out what's going on and see if we can make a difference there, and they found that they could. So now they're moving upstream toward the insurance industry to try and get that block into the insurance so that it's acceptable to say, we need someone qualified to go into that home and do the assessment and report back to us so we can make a prescription of what needs to happen. And I think it's going to take a coalition between contractors who have the ability, between the insurance industry, the medical community, to say this is something that we can do something about.
And that's going to take a major paradigm shift.
It's happening.
Yeah. Oh, yeah. I think so.
And
I agree with you.
And it's really, I think, the right thing for everyone to be doing.
Absolutely. Yeah, you really have to take a holistic approach to the built environment. I mean, you really have to look at everything. So everything interplays.
So you could like or not like the Affordable Care Act, but there are some provisions in it that are worth noting. One is the Essential Benefits Clause under Medicaid. So the Essential Benefits Clause used to say that a doctor could prescribe in-home services by a licensed healthcare provider. So imagine they're going in to administer medicine. Now it says that they can administer in-home services by a qualified service provider. So now the states are trying to decide, what does that mean? And in our case, we're working with the states to say that the Healthy Home Evaluator could be one of those qualified assessors to go into the home. So that's one big change. And the second big change is that hospitals are now penalized financially for repeat admissions. So knee surgery is like the #1 cause of repeat admission because they bungle it up. But then asthma is another one, and so hospitals now have a financial incentive to try and figure out why that keeps happening, why they keep coming back in. And again, this community that's been at it for 30 years is finally, it's like a overnight success that took 30 years to come into being. What's interesting is that the ERA stimulus funding did put some money into some studies in the weatherization, low-income weatherization community, and the WAP plus health, the Weatherization plus health program. Those reports are now coming out, and the reports are very positive that they made a difference. So you had houses that were a one benchmark, and then houses that were weatherized, and then houses weatherization plus health. And they then looked at the symptoms of people living there, and they were able to report out that there's some very positive outcomes. So that's a study that just came out from Oak Ridge National Laboratory. So I think, federal funding goes up and down. I'm looking for a solution where the contracting community who is up-trained and certified to understand how to do this evaluation works with the medical community and the insurance industry, and it's just the right thing to do for people in their homes.
Yeah, well, that sounds like a good opportunity for more training for the indoor environmental professionals.
And there you have it. On that note, we got to wrap. So, Larry, I'd like to thank you so very much for coming and spending some minutes with us this morning.
I love being here at the show.
Yeah, it's a great show. Larry Zarker, the CEO of the Building Performance Institute. Our continuing coverage of Green Build 2015, live from Washington, D.C. for Healthy Indoors Magazine. I'm Bob Krell.